This is from the Bipartisan Policy Center, published in 2020. And so it kind of starts with a reference we saw in the PBS piece on COVID and COVID impact on mental health in the United States. We saw the that part of that piece was sharing this the disaster distress helpline that's provided by SAMHSA. And so the article, one of the first data points from the article is the number of calls that have been received to this helpline have increased by 11 times in April of 2020 than versus when compared to April of 2019. So 11 times more calls into the helpline, disaster distress helpline, 1 year later when we looked at April of 2019 and then held it up against April 2020. So COVID-19 is not only disproportionately affecting communities of color, which we've probably read and heard about extensively in the news, but also exposing racial and ethnic disparities in access to mental health care. So and again, this is probably stuff you guys are well familiar with, all of the social and particularly health access based disparities along racial and ethnic and other lines of minority, including gender identification, gender preference, and residency status, are all exacerbated by COVID-19, I suppose, not surprisingly. So, so the Bipartisan Policy Center, the authors of this article recommend policymakers focus on promoting integrated models of care that have pre-COVID proven success in reducing health disparities. And this is a theme we have talked about. Hopefully that's come across throughout the course in our throughout the at least in the integrated healthcare course, integrated behavioral health policy course. This is the behavioral health integration to reduce health disparities is something that hopefully comes across as a theme. So research shows that behavioral health integration improves access to care and treatment outcomes, lowers rates of mortality, potentially reduces healthcare costs by 38 billion to 68 billion annually. So again, another theme of really all of my policy courses is that there is a tremendous economic argument to make in addition to the human human argument around not just improved access to health, but really all of the social policy and social justice issues that we are passionate about and dedicated to as social workers. In almost every circumstance, there is an opportunity to reduce costs, improve the economy when these things are properly addressed. So behavioral health training for physicians, social workers, nurses, and peer recovery support specialists, right? Peer and recovery support specialists. We heard Patrick Kennedy in a PBS piece remind us of the importance of peer support as part of that treatment, kind of treatment and recovery continuum. But proper behavioral health training for all these specialties across the disciplines will lead the way towards a health workforce that is more prepared to deliver integrated care and address the behavioral health needs due to COVID-19, right? So what's good for us in terms of how behavioral health integration improves outcomes, improves, narrows the disparity gap, and saves healthcare costs, and thus and reduces burden on the criminal justice system. It reduces burden on the law enforcement system. It improves our GDP and the robustness of our workforce. These are all things that integrated health has been shown to do. Behavioral health integration has been shown to do, and now it's even more important. And there's even a greater opportunity to do this in the era of COVID, according to the authors of this article. Okay, let me just finish erasing my markup here. So a couple more data points from our behavioral health integration article, or COVID-19 highlights the dire need to integrate primary mental health services. So a couple more data points here. So the authors assert that that states, Congress, and states should align commercial insurance and Medicaid telehealth policies with Medicare telehealth provisions that in the CARES Act and recent Trump administration waivers. So, so in some ways, particularly in our current times, there's been somewhat a unprecedented level, unprecedented for our current times, of bipartisan support for telehealth provisions in Medicare. There were funds as part of the CARE Act for telehealth, as well as policy support for CMS and telehealth services, and even supported by the president and a couple of executive orders that specifically, at least the way they were written, purported support for telehealth and telehealth services. So finally, from the Bipartisan Policy Center, Congress should provide funds to health resources and service to the Health Resources and Services Administration, other known as HRSA, to support fast-track targeted training opportunities for healthcare providers. So more important, anybody that is dealing with COVID as a health professional, which is, frankly, I don't know, I imagine almost every health professional. Certainly it's a factor in my own practice, big factor, that we need behavioral health training for those non-behavioral health specialty providers more than ever, because COVID is affecting everybody who's affected by COVID. It's somewhat extrapolated from the article that everyone's affected by COVID there's a mental health impact, and that's probably a reasonable